Thanks for tuning in. The topic's facelift. We've been getting some questions from some of our followers on social media about facelifts. And these are pretty basic questions, but questions I'm happy to answer. As long as you keep asking them, I'll keep answering them. So let's go ahead. A facelift is a procedure done to help reverse or change some of the signs of facial aging. And I say reverse with some qualifications, which is to say we're not reversing the signs of aging. I think we're making some of those signs of aging look better so that you can be the best looking whatever year old you are, but we're not turning back the clock. We are helping tremendously reverse and improve some of the signs of aging. You know, I get asked that a lot, and short answer is that it depends. You know, I tend to focus less on chronology and more on physiologic age or how people look. Aging and facial aging can be affected by all sorts of environmental factors like weight loss or gain, sun exposure, nicotine use, genetics, skin quality. And so a lot of factors go into it. We tend to see folks, and I get asked, I mean, I've even had 30-somethings ask me if they are a good candidate for a facelift. I have yet to see one. But you know, late 40s, early 50s, some of the signs of facial aging really can't be treated with non-surgical therapies like skin resurfacing, such as lasers or peels or soft tissue fillers. So people kind of, we see folks kind of segue into candidacy, you know, late 40s, early 50s at the youngest. For a lot of people who are in their 40s and have signs of facial aging, it's typically not a facelift. Sometimes we see folks, and again, even as young as their 30s, have signs of facial aging, but not requiring a facelift. Sometimes we just focus on those specific anatomic areas. So for people who have a predisposition for bags under their eyes, or a predisposition for a droopy brow, or excess skin of their upper eyelid, or thinning of the lips, we might do standalone procedures just to focus on those areas, but not a true facelift. Yeah, so how long does a facelift last? 15 to 20 years in my hands. We do what's called deeper facelifts or deep plane. We manipulate the platysma, which is a muscle underneath the neck, and we manipulate something called SMAS, S-M-A-S. It's an acronym for the muscles of the face. So, you know, skin is elastic, and skin-only facelifts may look good for a short period of time, but because it's elastic, they tend not to have a lot of longevity. Once you manipulate those deeper muscles and suspend those muscles into an anatomic position, they hold their position and a lot longer, and you get a lot more longevity out of it. It's one of the things I really focus on when I do a facelift. Nobody wants to look like they've quote-unquote been worked on or quote-unquote had a facelift. I think a better way to say that is nobody wants to look like they've had a bad facelift, right? And changing or altering the anatomy in a way that's unnatural is something to be avoided at all costs. So where are the scars when you have a facelift? For a facelift, scars tend to start right up here in the sideburn, or just right at the bottom of the sideburn. They go inside the ear. They go in the crease between your ear and your head, and then all the way back up here along your hairline between your scalp and the area behind your ear. Good question, and I get asked that a lot. And I think a lot of folks come in who want a neck lift, and they want a neck lift because the neck skin or the sagging of the soft tissues on the neck is really what troubles them. The short answer to that is a neck lift is everything from the bottom of your nose down. A facelift is everything from the corner of your eye down. So there's really not a tremendous amount of difference with regards to anatomy, length of surgery, expense, recovery with a neck lift and a facelift. Just whether we augment this area between the corner of your eye and the bottom of your nose. For folks who just want a neck lift and they're just troubled by this skin, they come in sometimes and they'll say, I just want you to do this. And yet they have loose skin along the jawline with if not advanced jowling, early jowling. And you can't do that, or shouldn't do that. You shouldn't just tighten the skin in one anatomic area like the neck and then leave hanging or loose skin in the adjacent area. That looks unnatural. And we want to avoid anything that's going to attract attention or appear unnatural. We want things to be harmonious. So we not only tighten the skin of the neck, but we tend to tighten some of the skin along the jawline too, just so there's a smooth transition between, again, the areas where we've treated folks and the areas where we haven't. All right, great questions, guys. Thanks again for tuning in. Check us out on robinsplasticsurgery.com. We appreciate you following us, and we look forward to seeing you soon.